AM 1060 WMEL. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. Our show is designed to inform, to educate, and to connect seniors and those that care for seniors with resources. It's extremely important that our senior population and all those that care for seniors are better informed about the many wonderful services that are available in chiropractic. And before I introduce my guest today, I want to say that in doing these shows since December 7th, 2000, this is the first chiropractor that I've had on a radio show in all these years. And I think that's extremely important because as you hear the show develop today, you're going to understand some of the benefits of good chiropractic treatments and some of the associated techniques that are now associated with chiropractic, and Dr. Timothy Bortz, my panelist, will explain all that. But just remember that our show is paid for, our organization is paid for by our sponsors. And we haven't been too successful in getting the county to recognize that seniors need to be cared for as much as children need to be cared for. And it's a battle. It should not be a battle. There should be enough money to take care of all people. And as I've told several boards that I've briefed recently, we get old and we die, and sometimes in the process of doing that, some people need more help than others. And we need to recognize that. We need to recognize that we are a country that can come together and do a lot of things, and that's been evidenced by some of the things that have happened in the last couple of weeks. But I'm not going to talk about that. We're going to talk about chiropractic today and Neurogenic Center. But the sponsors for the first part of the show include Kindred at Home, which is a long-term care hospital, the Eye Institute, Dr. Lee Sheldon, Bill Johnson, elder attorney, this radio station, Wichita Hospital Systems, Levin Home Care, Ebony News Today, Riverview Senior Resort, Organized Creative Design, which is a organization that helps seniors consolidate their estates and move into smaller quarters, and that's extremely important. But it's also equally important that you understand what our panelist today brings to the whole care equation. This is Dr. Timothy Bortz, and Dr. Bortz is the owner of the Neurogenix NerveCenter in Rockledge. And before I even talk about chiropractic, Tim, go ahead and explain to our listeners what you do at the Nerve Center and how you tie in chiropractic, your adjustment machines, your physical adjustments, nerve treatment. How do you do all that?
Well, thanks, Joe, for first of all having me on the show. We have actually I own two clinics in the same location, Brevard Chiropractic Injury Center, and we also out of that same location we have Neurogenix NerveCenter of Rockledge. The Neurogenix NerveCenter treats neuropathy patients. The chiropractic clinic treats patients chiropractic-wise, people that have been in accidents, so on and so forth.
What exactly then is a chiropractor, Dr. Bortz?
A chiropractor is a doctor that looks to the spine for the cause of problems. We look for joints that are misaligned or not moving properly, and we adjust them. We push them into the back, into the correct position. There are ligaments and muscles that hold those joints in the correct position, and when those joints become misaligned, it can stretch ligaments and muscles, causing pain in the area. Now, if those joints become misaligned enough, it can put pressure on the nerves that come out from in between those bones, and then you can have pain, numbness, or tingling to wherever those nerves go to. So with a simple adjustment, adjusting those joints back to the correct position, it can take pressure off of the nerves, relieving those symptoms. It can take tension off the ligaments and muscle, also relieving those symptoms in the back as well.
Hearing you describe that, harkens me to probably I might pair you up for a radio show with Dr. Lee Sheldon. Dr. Sheldon is a periodontist, but he's also probably one of the leaders in dental impacts. But Dr. Sheldon has talked so many times about the pressures exerted on the joints by the clenching of teeth and the jaws, and the problems it causes with the TMJ, which is an extension of the jaws, and it causes headaches. It can cause a whole slew of things. And so what we're talking about is you're like a chiropractor, does it adjust the whole body. The dentist works on the head part of it, but it's all connected, Dr. Bortz. And
Correct.
that's what people have to realize.
Correct. For headaches, there are many different causes of headaches. You can have pain in the neck, which causes headache, just having pain in the neck from the joints being misaligned. Also, when the upper joints in the neck, C1 and C2, which are the upper two cervical vertebrae in the head, when those joints are misaligned, it can put pressure on the nerves that control some of the blood supply into the head, which can affect or cause headaches. So by simple aligning of those joints, it can relieve some of the symptoms of headaches as well.
What does it take to get to be a
chiropractor?
Chiropractor. Yeah, what does it take to be a chiropractor?
It's 8 years of schooling. It's 4 years of undergrad and 4 years of chiropractic school.
So what's the difference between a medical doctor and a chiropractic doctor?
The first, we both have undergrad. The first 2 years of chiropractic school and medical school are exactly the same. We study anatomy. The second 2 years of medical school, they go in and study drug interactions and so on and so forth. We study how the body works, meaning how to adjust it.
So you both get 8 years of schooling.
Correct,
But
yes.
then they have to go do an internship after that?
Correct. Once they are done, if they want to be on staff at a hospital, they have to do an internship for a couple of years.
Does a chiropractor do an internship?
Out of chiropractic school, you don't have to. Many doctors, though, fresh out of school, they go work for another doctor, kind of get their feet wet. Like what I did, I worked for another chiropractor for a couple of years, and then I've been out on my own now for about 8 years.
So you work for another chiropractor for a
Correct.
couple years?
Yep, in Orlando.
Why is it, Dr. Bortz, with all... And the reason I'm asking these questions is because I have had extensive chiropractic treatments over the years. So I've had a lot of things done to me. I know what it means to have the spine correctly aligned. I know how much pressure can be taken off the nerves if everything was in the right place so things can function correctly. And if your spine's out of whack, you can't function correctly.
Correct.
You can't do that. But why don't the I want to call them medical forces recognize this and allow? With your training, you probably would know certain drugs and things that you'd want to prescribe. Why can't chiropractors prescribe?
We do not have the training in the drug aspect of it to prescribe medications.
Is that why?
Chiropractic is based on the belief that the body is a self-healing, self-regulating system. The brain controls the entire functions in the entire body, and it does that by sending signals through our spinal cord to the nerves out to every tissue and organ in our entire body. And when that system has interference, joints misaligned, pressure on nerves, that body or organ or tissue doesn't function properly. If you can relieve that pressure off of the nerve, then the body can self-regulate and heal itself. That's what chiropractic is based on.
Before the show, we were talking, and I told you about a time of some friends of ours that had been in a car accident, and they called us to come get them and take them home. We did that, and the wife made an appointment with a chiropractor that day, and I don't know what kind of adjustment she had, but their car had been totaled and rolled, and they were beat up pretty badly. They weren't cut up or anything like that. They were very, very fortunate. But she went to a chiropractor. He went to work. She had no problems afterwards. He had all kinds of problems. So, I couldn't say for certain that it was the fact she went to a chiropractor that day and the chiropractor did whatever he did, but there's got to be some truth in the matter somewhere along the line, and that's a big thing that you a big part of your practice involves treatment of accident victims.
Correct. At our clinic, not only do we do chiropractic, and we also take x-rays, on-site x-rays of patients as well, we have a whole physical therapy department to help patients that have been involved in car accidents. When you're in an accident, tissue has been damaged. If you don't heal that tissue properly through a rehab, exercise, and so forth, scar tissue can form. If you don't break up that scar tissue, then months and years later, you have decreased range of motion and chronic pain in that tissue just from the scar tissue. So going through proper rehab to strengthen that tissue back to what it was before the accident, that's what we do.
Let's say that somebody has been in a car accident or an accident of some type. Do you find that primary care doctors might refer somebody to you, or?
Oh, all the time, correct. We get referrals from other doctors in the area.
You get referrals from primary care?
Yes.
And yet, the primary care doctors recognize the importance of chiropractic treatment, yet the Medicare system itself, Center for Medicare in Washington, they don't reimburse chiropractic treatment nearly like they do.
No. There are thousands and thousands of codes for all different procedures. Chiropractic gets 3 codes, and there are 3 adjustment codes just for the spine. So when a patient comes into our clinic, I obviously have to do an exam, take x-rays, but unfortunately Medicare does not cover it. The patient has to cover the expense of that. After that, Medicare will pick up the tab on the adjustments.
So you can do x-rays in your clinic?
Correct, yes.
And would those x-rays be covered by Medicare? The cost
No.
of those? They weren't?
No.
So people would have to pay for that, but what I'm trying to figure out is how I can say to my listeners that there's an advantage to going to a chiropractor to find out, well, how does a person really know whether they should come to see a chiropractor, Dr. Bortz?
If they are having pain, either neck, back, joint pain, pain with movements, a chiropractor looks at the movement of the joints and see if they're in the correct position. We do that by physical examination and also x-rays to see if there's anything going on underneath the skin that we should be concerned about, such as arthritis. Okay. After that, adjusting the joints can help relieve the pressure, because again, if those joints are misaligned, it'll stretch that tissue, causing the pain in the back. Now, you can take muscle relaxers and pain pills, and that can help, but a pain pill isn't fixing anything. It's just masking the underlying problem, which is potentially joint misaligned, stretching the tissue in the area.
Okay, in my case, I know that I have spinal stenosis. I know that. I've been operated on, and I've had they opened up 3 areas of the spine, took some of the spine out to open up the canal where the nerve package lays.
Right.
I've had that done. I've had the shots in my leg, which have destroyed the nerves, so that I couldn't feel pain. I've had the pain injections, the pain shots, been on the pain pills. I've had diagnosis of fibromyalgia, and I've gone to, in fact, just after I saw you, when you showed me everything that you do in your facility, later that day I saw my primary care physician, and he asked me some questions, and he watched me walk, and he knows that my right leg, which have had a hip implant, is weaker than the left leg, and he's concerned about that. And I told him I was trying to get back in the swimming pool and swim, because the physical therapist had said that in my case the swimming would be very good, but not all people can do that. So how do you, in chiropractic, when you do the adjustments, how do you determine whether this should be like a weekly adjustment, a monthly adjustment, or something? I don't think it's a one-time thing, is it?
Correct. No. When we adjust the joints, we move those joints just a little bit per each adjustment. Okay. There is no way to make an adjustment on the joint, and put a brace on that joint to hold it in the correct position. So we essentially need to adjust the joints frequently to get them back into the correct position and give the ligaments and the muscles a chance to stabilize and hold in the correct position. And until that happens, that's when we normally see patients frequently. Once the patients start reporting back to us that their symptoms are getting better, they're feeling better, that's when we start decreasing the number of visits down. So we always start at 2 to 3 times a week, depending on what the condition is and how bad it is. I've had some patients come in that are in such severe pain, I'll see them daily for a week. Once their symptoms start dropping down, then we start spreading out the time that we see the patients. So I might adjust them twice a week when they start feeling better, down to once a week, and then once every 2 weeks, and once a month or so.
There probably are listeners at home sitting here listening to you and me talk on this radio and saying, I wonder if Dr. Bortz could help me. Is it fair to say to listeners that the only way you're going to find out the answer to that is to go see you, and you do, from the equipment I saw in your place of business, I assume you can do a pretty good workup on somebody like they would in a rehab place, or they would like a doctor does, like a physical examination. But it's like a chiropractic physical.
Correct, yeah. It's the exams that we do are just like the exams you get at your medical doctor. We are chiropractic physicians, not medical physicians. So we just have different schooling, but we're still classified as physicians, correct?
But if somebody is wondering if it could help them out, the only way they're ever going to know is to go in and find out. And there are probably some of the adjustments that are covered under Medicare that in conjunction with maybe some of the other things that you could do for them, that there would be a cost to them. There might be a way to marry these things up so people can get some kind of an idea of a treatment plan. You put into words what I'm trying to put into words. You know what I'm trying to say.
The first step is obviously examination. We need to examine the patient who with their complaints and see if something is there that we can potentially help them with. And we do that through examination and x-ray. If someone comes in with some severe something we don't deal with, we obviously refer them out because we help with the spine and adjustments of the spine. And again, we normally start seeing patients frequently to start, and then once the patients start getting better, we start dropping their visits down from there.
Okay. That's the chiropractic side of it. And the chiropractic side enters into, say, the accident treatment side of it. Can you explain the correlation between the chiropractic and the accident treatment side?
Sure. We also see car accident victims at our clinic. The importance of chiropractic with people that have involved in accidents is when you're involved in an accident, tissue has been damaged, and the joints can become misaligned. And you can rehab that surrounding tissue, but if the structure itself is still misaligned, the muscle and stuff might be rehabbed, but the structure is not in the correct position. So adding chiropractic to the rehabilitation, you can make sure that the structure is in the correct position and then facilitate the rehabilitation of the ligaments and the muscles around the surrounding areas. So it helps both.
Do primary care doctors consider that when they're treating the patients? You've been in an accident, you're in the hospital, and you've been sewn back up. And you got all the underlying problems. How does the patient find out how to treat the underlying problems, though?
Hopefully, they get a referral to their primary care doctor, and their primary care doctor is educated enough to know that chiropractic can help with that as well. We found a lot of time with car accident victims, because it has to go through their auto insurance, primary care doctors don't want to have to deal with that. So that's why they send out to clinics like myself that deal with auto accidents.
So then can you approach the car insurance type people?
Yes. Yeah.
Do you do that a lot?
Sometimes, yeah.
So what good information can you, as a doctor of chiropractic, along with everything else you do with your Neurogenic Center, we're going to talk about that on the second part of the show. Well, I don't want to get into that now because this will be confusing people. But how do people realize that there's more than just sewing up and suturing and putting all that stuff back together. But underneath the system there's the adjustment part of it. I never really even considered that part of it before, Dr. Bortz.
Yeah, a lot of it is word of mouth. If you've known someone that's gone to a chiropractor, talk to them, ask them about their experience. We do free consultations at our clinic, so you can come in and sit down and talk to myself or my associate, and we'll sit down and discuss your problems and see if it's something that we can help you with.
When they come in for a consultation, do you generally take an x-ray?
During the consultation, no. We sit there and talk to them about their problems. They express to us what their problems are. We let them know what chiropractic is and if it can help their condition that they're coming in with.
What are some of the things that you discuss with an accident victim? What do you talk to them about?
We talk to them about the type of rehab that we do at the clinic, how long it will take, what to expect, and basically let them know how we're going to help them throughout the treatment.
Rehab at the clinic. I saw your rehab room. I saw the balls. I saw the weightlifting machines. I saw the things that you had there. I know that you're equipped to do what any good rehab center is equipped to do, but what other forces do you bring in your clinic to treatment of accident victims beyond the rehab part and the chiropractic?
Well, we also have a spinal decompression machine at our clinic. Unfortunately, what can happen with accidents is people can have injuries to their discs, can have herniations.
We're going to have to take a break. So we'll take the break and we'll come back and we're going to talk about what Dr. Bortz is talking about, because I'm very familiar with what he's going to talk about. It is a decompression machine. You need to understand this, folks. This is something you don't know about. So stay with us. We'll be back in about 3.5 minutes.
AM 1060 WMEL.
This is Joe Steckler, folks. We're back live with the second half of Helping Seniors. I remind you again that the show is designed to inform, educate, and connect seniors and those that care for seniors with resources that can help them live a better life and maybe just live. The phone number to call our information specialist, Kay Kaiser, who is listening, is probably going to chide me after the show because I forgot to mention Kay. And the phone number is area code 321-473-7770. How's that sound, Kay? Now you can't pick on me and say I forgot the second part of the show. That's the value, folks, of talk radio. If you make a mistake, you can correct it. But the sponsors for the second part of the show include Senior Scene Magazine, Hometown News, Spotlight Magazine, Seniors Helping Seniors, The Fountains of Melbourne, Courtney Braswell, Financial Advisors, Barbara McIntyre, Canadian Meds of Melbourne, and folks, that's something you want to think about. We've got one medication that doctors use very, very frequently as an injection into a knee to pad the joints, and that injection costs, I'll say, $1,200 here in the United States. You go through Canadian Meds, you can buy the same drug made by the same company in the same package for $179, and the company that makes it still makes a profit. The guy that sells it in Canada still makes a profit. So does Joe Pons at Canadian Meds. He makes a profit, and you have saved close to $1,000. Doesn't that make a lot of sense for starting to think how you can change your modus operandi? And that's one of the reasons I was so excited when Dr. Bortz said that he wanted to be one of our sponsors, and he wanted to bring to our community awareness of what chiropractic can do, what the Neurogenic Center can do, what the accident treatment plan can do for people, how we can marry up different programs. And just during a break, he informed me of something that I didn't know about, and it's important that we start to recognize this, because I think that we seniors can probably start to have an impact with our legislators, trying to ask questions why some things that we do are not done differently. And one of them points is a good point. We were just before it got cut off, Dr. Bortz was talking about his decompression machine. So pick up their doctor and talk about what the decompression machine does. And if you don't mention the business about insurance, I will, because I think this is why readers and listeners need to hear this stuff.
Gotcha.
Go ahead.
The device we have is a non-surgical spinal decompression machine. People can have herniations in their back, disc bulges, protrusions, or herniations. A herniation, think of a jelly donut. You ever squished a jelly donut and jelly squirts out the side? That's kind of like a herniation in the disc. The disc is kind of like the spongy cartilage material in between the vertebrae, the bones in the back. When that squirts out, it unfortunately kind of comes out to where the nerves are. And when you have pressure on a nerve, you feel pain, numbness, or tingling to wherever that nerve goes to. If you have a herniation in your neck, you'll get that sensation down the arms. If you have a herniation in your lower back, you get it running down the legs. What non-surgical spinal decompression does, it essentially pulls or gently tractions out those joints in the lower back. Because the disc is connected to the bones above and below, when you pull those bones apart gently, that creates a negative pressure, kind of like a vacuum inside that disc. So anything that is bulging or sticking out kind of gets pulled or sucked back in. Let me give you an example. Have you ever squeezed a tube of toothpaste and the toothpaste comes out, and then when you're done, you take your hand off and the toothpaste kind of gets pulled or sucked back in? Same concept. That's a negative pressure pulling that toothpaste back in. That's what our spinal decompression machine does to the discs in the lower back that have bulges, protrusions, and herniations. So it's a non-surgical treatment for those problems.
And I want to talk about that a little bit. I know from having seen your machine is probably one of the more up-to-date ones. There are different types.
Correct.
There are some that can do a better job of gently pulling somebody apart. Now let's talk about what Dr. Bortz has talked about. He mentioned the word surgery. I know somebody that went through a lot of agonizing surgery, had stuff put in her back that didn't work the right way, and before a lot was done, we tried the decompression route, but it wasn't, I don't think, done the right way. And I think that had she seen you, it might have made a difference in what we've had to go through with the surgery and the treatment and all the hardware in the back. What Dr. Bortz was talking about, folks, this business of gently stretching the body to pull stuff back in, it makes sense when you start to think about it. But the thing I think, doctor, is that most people think of a chiropractic as a doc getting in there and a doctor getting their arms up over their head and doing like a reverse hemlock on them, so that you're adjusted. Walk out of here, you're fine. Chiropractic is a science.
Correct. Yeah.
And it's not something that just happens overnight. It's patient. But I can think of people that have gone in for laser spine surgery. Laser spine surgery is not covered under Medicare.
Correct.
And those things cost $30,000 and $40,000 a whack, and you don't know if it's going to be successful or not. Hopefully it is. At least those doctors will tell you it is. But I've seen where they've had to have any type of surgery. Anytime you go to a doctor, other doctors can correct or uncorrect a lot of things that doctors do. Medicine is still not an exact science.
Correct.
So
you should always do the least invasive first, and then if that doesn't work, then take a step up. You can't go back from having surgery, having rods and screws installed. You should try everything first to see if that stuff works, see if you can get relief first, and then, worst case scenario, if that stuff doesn't work, then move on up.
Yeah, but I think it's just like people trying to make a decision whether to have an implant or a tooth capped and another tooth hung from that to fill the space. Sometimes it works, but not maybe as well as an implant would. You have to measure what you want to do and what you're willing to part with this unearthly thing we call cash that we can't take with us. So I guess my point, Dr. Bortz, is why in the world a person is willing to live with pain every day in order to save a couple $1,000s. It doesn't make sense. And I know that we spent quite a bit of money and doing some of these treatments that we did for my wife, but for us it was like trial and error. We didn't know. Now we know a lot more, and that's why when I talk to you on this radio show, I feel comfortable asking you questions, and I look at you, and if I don't get something, I'm going to ask it again. But you've given me an honest answer as to why we do some things we don't do. The other part, I think that I do want to talk about this before the time runs out today, because we're going to do a TV show on this, is the neurogenics part of your practice. I think it's important for people to understand that. We've given them quite a lot of mix and match today, but first, what is neuropathy? And no, wait, before we talk about that, you forgot it and I forgot it. We were talking about the treatment, and I thought the ironic part was that if a person needs this decompression treatment, car insurance will pay for it.
Correct.
But medical insurance will not.
Correct. Why that is, I have no idea, but decompression has been around for over 20 years, and still health insurance don't pick it up. But for whatever reason, if you are involved in a car accident, it will pick that up. Yes, it will pay for it.
But as I was saying, everybody's involved in a car accident, and when you get bumped from behind, you get neck pain and everything else, you might start asking more questions. That's the value of listening to the radio show, Doctor, is that people get an idea of a question to ask. They also get an idea of where they can go for possible treatment, and they can get treatment that maybe is not as invasive. I had my gallbladder removed with 3 points in my chest when they took the gallbladder out and didn't cut me open. But we call that surgery.
Mm-hmm.
What kind is that?
Surgery? Laparoscopic surgery.
Oh, yeah, laparoscopic surgery. Laparoscopic. But let's go ahead and let's talk about the neurogenics part of it, because I first of all, explain to people what neuropathy is.
Yeah, neuropathy is when the small sensory, we have motor nerves and sensory nerves. The smaller sensory nerves, through insult, whether it be through, well, the most common cause is through diabetes, but there are other insults to those nerves. People that have had some chemotherapy, some are idiopathic, meaning we don't know what causes it, but those nerves are slowly dying. And when they slowly start dying, you get pain, numbness, or tingling in those nerves. And it's most often in the lower extremities, in the feet, starts in the feet or the toes. There are some patients that get it in their hands as well, and those nerves are slowly dying. And what this device does, what this treatment does, is it gives the correct stimulus to those nerves, because every tissue in the body, if given the correct stimulus, has the potential to regenerate and heal. This device gives the correct stimulus to those nerves so that they can slowly heal. And when that happens, the pain, numbness, and tingling, those things slowly go away.
How long have you been doing this?
The Neurogenix NerveCenter here in Rockledge has been open for 4 months. We were the second clinic to be opened in the state of Florida. There are now 5 open in the state.
Only 5 in the whole state?
Correct, 5.
How long does the average treatment, if you have a diagnosis, the primary care doctor could diagnose neuropathy, right?
Correct, yeah. We can also diagnose it at our clinic. I am the one that does the consultations with the patient. I have an advanced registered nurse practitioner, a certified nurse practitioner who does all the examinations on all the patients that come in. And then our medical director is a neurologist. We kind of review all the patients that come in, all the examination findings at the end of the day, and then we make a determination on whether or not this patient actually has neuropathy, actually has something that we can help them with. And then we let the patients know.
So once you determine a person has neuropathy, and you have to use the treatment on them, what is the average length of time that you would say that a person, if it's going to be successful and it's going to work, how long does it actually take?
Well, when a patient starts treatment with us, we monitor them for an entire year. The majority of the treatment is given in the first 3 months. It's 2 times a week for 3 months. Now, we have had some patients get some relief after a few weeks. The majority of the patients take maybe 2, maybe even 3 months till they start feeling relief. Then we at the end of the treatment, at the end of 3 months, we have them come back throughout the year, 1 month, 3 months, 6 months, and a year, to do reevaluations on them to see how they're progressing. It's normally a lot of patients at that first reevaluation, a month later, that they come back and say their symptoms have decreased, their pain has gone away, I can wear my shoes now, I can feel the pedals when I drive my car now. That's what we're hearing.
Is neuropathy painful?
For a lot of people it is. It normally starts out, and everybody's different, but it normally starts out with some pins and needles, some tingling in the toes or in the feet. Some people experience pain. Worst case scenarios, those nerves are dying a lot. You start feeling numbness where you can't sense your toes or your feet. When you have numbness in your feet, what the normal progression is, patients start losing their balance. So their gait starts getting wider. They start wobbling. Then they start using canes, and then walkers, and then worst case scenario, wheelchairs.
You described my symptoms, well, you described my case exactly, but I have a different problem. But my problem manifests itself in the same way with the gait and the step and the balance. And all these things are related somehow. And what bothers me, Dr. Bortz, is that so many people have problems, but they don't know where to go for help. They don't have information, and they don't have access to information. So years ago, Dr. Hernandez, who was the Secretary of Elder Affairs for the state of Florida, came up with the idea of what she called elder-friendly communities. And she talked about wide streets and sidewalks where people could walk and do all this stuff. It really, an elder-friendly community is whether or not a person can get the help they need to live a life as pain-free and with as much dignity as possible. And if we can do a better job of publicizing what chiropractic is, what you do at your Neurogenic Center, what are the best case scenarios for people that have been in an accident, where should they go? And the more we can get doctors of the medical type and doctors of the chiropractic type to work together, I think that the average citizen profits by that. Can you comment on that? Do you agree with that?
Oh yeah. If people know what services are out there, that's the first step. Knowing that they can be helped. The clinics that I have here, we can help a variety of people with many different health issues and health problems.
We've talked about chiropractic, we've talked about Neurogenx, Dr. Decompression, accident, the rehabilitation. What other things do you do that I haven't asked you a question about at the Neurogenic Center?
Well, we also offer massage therapy at our clinic. Our massage therapist is on staff 3 days there. Massage therapy is very beneficial for patients that have muscle issues. As tissue heals, it produces waste product. Unfortunately, the body produces waste product faster than what we can get rid of. So what a massage does is a massage pushes that waste product out of the muscles so that those muscles can heal faster. So massage therapy is very beneficial, not only in the accident side, but the chiropractic side as well.
I've never heard it described that way, with the pushing of the waste material out of the muscles. That makes a heck of a lot of sense.
Yes.
I went to a massage therapist one time, and it sort of started in the middle of the back, and it rolled the skin under the fingers, and it started rolled it all the way up into my shoulders. Mm-hmm. Is that the kind of thing you're talking about?
Yeah. There's several different types of massage therapy. Probably the most beneficial one is deep tissue, where they get in and they really push the waste material out of the muscles.
So you have quite a package up there at the...
At Brevard Chiropractic Injury Center, yes.
Yeah, you finally said the name of the place, the Brevard Chiropractic
And Injury Center, yes.
and Neurogenic Center. But it's both. But I think it's important. I think it's extremely important, Dr. Bortz, that our listeners realize that the neuropathy treatment that you're describing under the Neurogenic Center is not something that I thought it was more widespread. I didn't realize it was such a new thing in Florida. Is it as restrictive in other parts of the country, or is it something new? What
the technology has been around for many years. The company is based out of Michigan, and the units that we have, they used to sell the units to podiatrists because podiatrists look at the feet, and that's where neuropathy normally starts. But starting last year, they started opening up just Neurogenic Centers. And I think there's 14 or 15 Neurogenic Centers in the United States right now, and they're continuing to open them as we speak. So.
Well, that's kind of like some other doctors I know that are trying to take specialty type things that are extremely important to people that people don't know about these things, and so we have a lot of treatments that could be beneficial, especially to seniors. Perhaps you could just take a short time and comment on the benefits of the neuropathy treatments for seniors, or is that something that's more? Are seniors more prone to have neuropathy?
In general, yes. The vast majority of the patients that have come through our doors have been 60, 70, 80 years old. A couple 90-year-old patients as well that have neuropathies, and we have helped them as well. But there is no age minimum or maximum for neuropathy. We do have some patients that are in their 50s that have had diabetes for 15, 20 years that are developing neuropathy, and we treat those patients as well. But in general, yes, it is older population.
You just said a key word with it, and what are some of the general causes of neuropathy?
The most common cause is diabetes. Some patients can develop neuropathy having diabetes for just a year or two. Some can have diabetes for 20, 30 years, and they just started developing neuropathy. There are other causes of neuropathy. If someone has cancer and has chemotherapy, some of those drugs, some of those medications that they take can potentially cause neuropathies as well. There are some genetic conditions like Charcot-Marie-Tooth, which is a disorder of the peripheral nerves where those nerves aren't functioning properly. There's idiopathic, meaning they don't know what causes it. That just seems to develop in patients. So there's many different causes of it.
So that gives more cause for people having, or a better reason for people having more frequent checkups with their primary care doctor to test for their whole body.
Correct.
We don't do physicals the way we used to. I don't even know what would be a common way somebody might discover they have diabetes, Dr. Bortz?
You have to go to your primary care physician and get blood work done.
Blood work, you can't feel side effects from diabetes?
It's very possible not to at all. That's what the blood work can detect that.
Wow, that's something to think about. I know that almost every time I do a show with Dr. Sheldon about periodontal care, the subject of diabetes comes up. I have done several shows with podiatrists, and I had come out of the Navy home at Gulfport, Mississippi, and I know the value of good foot care. The diabetes is prone to swelling in the feet in older people, and it's one of the greatest causes for foot amputation. We lose a lot of feet from seniors simply because of diabetes.
Correct, because there's constant insult to those nerves, and those nerves are slowly dying. Yeah. And this treatment, the Neurogenics treatment, can regenerate those nerves and help save that. Help save
the feet like that? We're just about out of time. What advice would Dr. Timothy Bortz give to people about what they might do to have better care of their spinal system?
You can give us a call. That's Brevard Chiropractic and Injury Center. The number is 321-631-1100. If a person has neuropathy, we have a call center that can be reached 24 hours a day. That number is 321-222-9370.
Thank you, Dr. Bortz. And folks, everything that Dr. Bortz and I have talked about this afternoon will be on our website, helpingseniors.brevard.org, within 24 hours. So listen to us again. See you next week.